Good afternoon, and thank you for joining us. Today is Tuesday, August 3rd, and on today's briefing, we'll hear from Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Medical Director with Milwaukee County Office of Emergency Management, Commissioner Kirsten Johnson, Commissioner of Health with Milwaukee Health Department, and Deborah Hefner, Housing Strategy Director with Community Advocates. Thank you all for being here, and Dr. Weston, I'll hand it over to you to get us started.
All right, thank you, Catherine. Good afternoon. First to our numbers, we're currently seeing. Can you hear me?
Good.
All right, first to our numbers. We're currently seeing in Milwaukee County an average of 220 new cases per day and about one death every 2 days. And a lot has happened in our last week. So first to the trends, they're frankly not good. So as all 50 states continue to see increases in cases, we're now also seeing an increase in hospitalizations. Now, as we know, COVID surges have tended to follow a timeline. First comes the rise in cases, and then a couple weeks later, hospitalizations, and then, of course, unfortunately, deaths. Now, as cases continue to rise, we've now entered the phase of increasing hospitalizations. The state of Wisconsin has seen a fourfold increase in hospitalizations in the last 4 weeks. And that's worth repeating. We've had 4 times as many people hospitalized with COVID in Wisconsin as we did 1 month ago, from 74 individuals to 310 today. Now, similarly, in Milwaukee County, we've seen a tripling in the COVID patients who are hospitalized. So this surge is not just causing mild symptoms, it's putting people in the hospital, and it'll soon cause a rise in deaths as well. Now, we know that the Delta variant is the reason for this surge. And last week, we learned more about the Delta variant from the newly released CDC data. And I'll try to boil down the key points that we've learned. So first, the Delta variant is extremely contagious. In fact, it's one of the most contagious viruses we've ever seen, at the same level of chickenpox. And for those of us who remember chickenpox, everyone got chickenpox at one point or another. That is, until the vaccine was developed. Now, second, those who are vaccinated are still far less likely to get infected with COVID than unvaccinated people, about 3 times less likely. However, as we've always known, the vaccines are not bulletproof, and breakthrough infections can occur, especially now when there's a lot more disease in the community. Now, third, and this is very concerning, the viral loads, the amount of virus in your body for the Delta variant are very high in infected people who are unvaccinated as well as vaccinated. And so this means that those who are vaccinated with a breakthrough infection still can fairly easily spread the virus to others. And this is what prompted the new recommendations that everyone mask to decrease the risk of transmission. And fourth, vaccine is still highly effective in preventing severe disease and death from Delta. If you're unlucky enough to have a breakthrough infection, while vaccinated, you have a 10-fold or greater reduction in risk of severe disease or death as compared to someone who's unvaccinated. So what does all this mean? It means that vaccines are very effective in protecting you from infection, but especially protecting you from severe disease and from death. The vaccines simply work. Now, that said, since you could get infected and spread the disease, you must continue to take precautions to prevent the spread to others. So what can you do moving forward? Of course, the best thing to do is to get vaccinated. Now, the next best thing is to distance and wear a mask when indoors in public spaces. Now, for many of you watching this, I may be just preaching to the choir. You're already vaccinated, you're wearing your mask, you're distancing, but there is more that you can do. You can reach out to that friend or that relative who's not yet vaccinated. It may seem like an awkward conversation to start, but it's a critical one. Share your experience with the vaccine. Tell your story. Many people who are not yet vaccinated have fear of what they see as an unknown. So make it known to them. You could help them to protect themselves and to protect their community. And that's something we can all do. Thank you very much, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. In the city of Milwaukee, our disease burden jumped from 75.7 cases per 100,000 last week to 193.2 this week, putting us in the extreme transmission category. Similarly, test positivity increased to 10.1%. We anticipated an increase in positive cases due to the prevalence of the Delta variant in Milwaukee, but 155% increase in 1 week is distressing. Since receiving data earlier this afternoon, the Milwaukee Health Department has been in discussion with the mayor's office and common council members to determine which steps need to be taken to prioritize the health and safety of Milwaukeeans. However, our messages have not changed. We need more people to get vaccinated and wear a mask indoors. Even with this increase in positive COVID cases, like I said, the message is the same: get vaccinated. As Dr. Weston said as well, the vaccinations work and are effective against severe illness and death. 50.8% of Milwaukee adults over the age of 16 are fully vaccinated. This is only a 0.8% increase since we hit the 50% threshold a week and a half ago. Please get vaccinated. Community vaccination is all hands on deck. For those of you who have already been vaccinated, like Dr. Weston mentioned, tell your story. Talk to your loved ones, your friends, your family members, answer their questions and address their concerns. And if you have to, drive them to get vaccinated. Last week, the Milwaukee Health Department released an advisory for everyone, regardless of vaccination status, to wear a mask when indoors in public spaces. Face coverings keep you and those around you safe. Please mask up. In addition to masking, the CDC released a recommendation for fully vaccinated people who have a known exposure to someone with suspected or confirmed COVID-19 be tested 3 to 5 days after exposure. Those who are fully vaccinated do not need to quarantine until they receive a negative test, but should be diligent about wearing a mask in public. We also encourage anyone who has attended a large gathering, such as the watch party in the Deer District, to get tested for COVID-19 due to the increased risk of transmission. Contact tracing and testing for cases associated with the Deer District is still ongoing. The Milwaukee Health Department has been working closely with the Wisconsin DHS and has identified 427 cases statewide. Please continue to get tested if you've attended a large gathering to ensure you're not spreading the virus to unvaccinated individuals. Testing is free, quick, and easy, and available throughout the city at the Northwest Health Center, Southside Health Center, and at American Family Field. Starting yesterday, our hours at the Northwest Health Center and Southside Health Centers were adjusted to accommodate a mix of morning, afternoon, evening, and weekend hours. Both locations offer testing and vaccination on Mondays and Fridays from 9 a.m. until 3 p.m., Tuesdays and Thursdays from 12 p.m. until 6 p.m., and Saturdays from 9 a.m. until 1 p.m. The clinics are closed on Sundays and Wednesdays. The hours for the American Family Field have not changed. More information on testing can be found at our website, milwaukee.gov/COVID testing. In addition to our health centers, the door-to-door canvassing and in-home appointments, the Milwaukee Health Department team continues to bring vaccination to community events. Vaccines will be available tonight at MPD District 2's National Night Out at 2201 South 7th Street from 4 until 7:30 p.m. and tomorrow night at MPD District 4's National Night Out at 7801 West Acacia Street from 3 until 7 p.m. If you attend these neighborhood events, please get yourself and your family vaccinated. Finally, anyone who missed last Friday's back to school health fair is encouraged to attend the second health fair this Friday, August 6th at the Southside Health Center, located at 1639 South 23rd Street. We'll have childhood immunizations available, COVID-19 vaccine for anyone over the age of 12, free backpacks and school supplies, and information about MHD programs. As an incentive to get our children ready for the school year, anyone who gets immunized or shows they are up to date with their immunizations will receive a free zoo pass donated by the Milwaukee County Zoo. Hope to see many of you this Friday. And I will turn it back to Catherine.
Thank you, Commissioner Johnson. Now we'll hear from Deborah Hefner with Community Advocates.
Good afternoon. Thanks for having me. So as you mentioned, I'm Deb Hefner. I'm the Housing Strategy Director at Community Advocates. I'm also joined by our Chief Executive Officer, Andy Elliott. So we understand that there's a lot of households suffering, and that, with the eviction moratorium lift over the weekend, that there's a lot of concern. So today we're here to talk about the availability of rental assistance, emergency rental assistance, and also the groundbreaking effort of the Milwaukee Rental Housing Resource Center that is a collaboration of partners working together on eviction diversion in Milwaukee. So first, some quick background. As you see up here, here's the logos for the array of co-partners that are implementing the center. And so that's the partners essentially are what makes this effort truly groundbreaking. So this effort started before COVID, but our efforts have greatly accelerated. And so the idea is that we have built a triage team, a hotline, a website, and an email address where we can address concerns from landlords and tenants and connect you to resources. So the ideal is that the resources are received pre-filing, but we're identifying tools throughout the whole spectrum of pre and post filing that can really assist and essentially keep people in their homes. So next slide. We have some tips here for if you are currently behind in your rent. And so if you're a tenant who's behind, again, we're encouraging that you apply for rental assistance. There is unprecedented amount of need, but also unprecedented amount of resources in Milwaukee. The federal government, has provided us with, millions of dollars within the state, and the county and the city of Milwaukee has been working very closely with the state to be able to make sure that these resources are allocated to Milwaukee because we're seeing such great need. So the main providers in the city are community advocates and SDC. If you have already applied, we understand that there can be frustration with delays. We appreciate everyone's patience. If you were approved by community advocates, we're working to process those checks. But you can be assured that those funds are there and that they exist and that they're intended to be able to help people. The other, tips that we have is just to be able to work, with mediation and legal as well. If you can just go back to the previous slide, Catherine. Sorry, I bumped it. But through our partnership, the Milwaukee Rental Housing Resource Center, we're able to connect tenants to resources such as mediation and legal, and really be able to address, the current situation. Thanks. Next slide, please. And if you are a landlord, again, we understand that you are suffering as well. These resources are here to help you. And so again, if your tenant has not applied, we encourage your tenant to apply if they've had financial hardship and are low income. And again, just know that there are other cost and time effective tools that exist through the Rental Housing Resource Center that can help the situation, whether it's non-payment or even other rental housing issues as well. And then how to find us, the very last slide, thank you. So I mentioned we have our website, renthelpmke.org. On that website, you can get connected to the rent assistance providers, those applications. There's online applications at community advocates. You're able to actually come and pick up a hard copy application as well, and really be able to access those supports online as well. We also have social media. And I mentioned that hotline number down there as well, the 895-RENT, where you can call and get access to a member of our triage team. So we appreciate the patience and looking forward to helping as many people as possible stay in their homes.
Thank you for joining us. We really appreciate you sharing those resources. We will now move to the media Q&A portion of our briefing. We have a few questions coming through. The first appears to be from Allison Durr for Commissioner Johnson. She says, regarding the finding that more than 400 cases were related to the Deer District celebration, were those cases concentrated in Milwaukee or distributed across the state? And how many of those cases were in unvaccinated people?
So the cases are distributed across the state. Obviously, the largest concentration is the city of Milwaukee and Milwaukee County, but there were cases, Dane County, Ozaukee County, Waukesha County, they're all over.
Okay, and her next question is, Also, how many contact tracers does Milwaukee Health Department currently have? And is the department looking at increasing its numbers of contact tracers given rising case numbers?
So we currently have 5 teams of 12 contact tracers, and we're planning on hiring a handful more. But we anticipated that cases were going to rise, so we've been prepared for this for some time.
All right, our next question comes from Vanessa Swales with Milwaukee Journal Sentinel. And she says, recent legislation has already proposed by 6 other council members would require masks inside if the transmission level in the city reaches 100 or more cases by 100,000 people. Is it likely then that the city mask mandate will be reinstated given that the case burden reported as of today has reached 193.2 confirmed cases per 100,000 and we are in a period of extreme transmission?
So I am working closely with the Common Council on identifying what would be most appropriate.
And for Commissioner Johnson, Vanessa's second question is, Los Angeles, the state of California, and New York City will require employees to prove that they are fully vaccinated against COVID-19 or test negative for the virus weekly as a condition of coming to work. One Milwaukee Common Council has proposed a similar legislation. Are there plans to implement similar requirements?
So I've been working very closely with the Department of Employee Relations on mandating vaccine for employees, and we're currently working through what that may look like. And I would offer that Dane County, I believe, passed or announced today they were going to have similar requirements.
And Vanessa's third question is, New York City will also require vaccine proof for indoor dining, fitness, and other activities. Are there plans by the county or city to introduce similar requirements?
I can speak to this for the city specifically. I spoke today with a number of our entertainment venues. There are conversations about potentially requiring vaccine proof or a negative test in multiple venues, but nothing is finalized.
And if you are interested specifically for the county, we can address that one offline as we don't have our elected officials joining us today. So I can follow up with you, Vanessa. Our next question is from Brett Lemoyne with Fox 6. He says, if anyone is planning to attend State Fair, what do you suggest they do to stay safe and healthy?
Sure. So I would say first and foremost, if you're unvaccinated, you may want to think twice before going to an area as crowded as State Fair. Given the current surge, your risk of infection and severe disease is quite high if you have not received the vaccine already. Now, even for those who are vaccinated and may plan to attend State Fair, I think there's a few items to keep in mind. So first, staying outside as much as possible, avoiding indoor spaces. Your risk of infection is substantially lower outdoors. Second, avoiding crowded areas. And that's whether it's indoors in particular, but even outside if it's particularly crowded, like we saw in Deer District and places like that. And third, certainly wearing a mask when in crowds and absolutely whenever you're indoors. So I think there's certain precautions you can take if you are planning to attend State Fair.
Mary Jo Ola with TMJ4 is wondering, what will it take for kids and teachers to return to school safely this fall and continue in-person learning? What are your biggest concerns?
So I think what we learned over the past year is that kids can go back to school safely. Even during some of the larger surge last fall and winter, children were in school throughout the state, and a lot of research was done on how to mitigate risk. We know that requiring kids to be masked is effective, physically distancing within the classroom, but we saw very little transmission in classrooms. I mean, the advantage of a school setting is that it's controlled, and as we saw throughout all of last year, it's safe. I do want to name that I am concerned. Children are not yet able to be vaccinated. I think it's critically important that our teachers and staff are vaccinated, but also consideration needs to be given for children who are immunocompromised and cannot necessarily attend school while there's a pandemic or a virus circulating. So a virtual option for those children is critical.
I agree with everything that was said. I would just add that I think we're in a very different period than we were a year ago. A year ago, schools had to get together medical boards and send out surveys and try to figure out what to do because frankly, there wasn't great guidance on there for how schools should move forward. That's different now. The CDC has laid out very clear guidance, evidence-based guidance, expert-derived guidance. The American Academy of Pediatrics has laid out guidance that is the exact same, which is you need to do layered protection. Absolutely, kids as much as possible should be doing in-person school. We've learned that. Everybody's learned that over the last year and a half. But we've also learned is that a layered approach is very important. A vaccine is a key part of that layer, getting as many people as possible in that school vaccinated. But as Commissioner Johnson said, a large portion can't be vaccinated. Nobody in any state, in any county under 12 is vaccinated. So we have to keep that in mind. So the vaccine is an important layer, but equally important right now is masking, is distancing, is ventilation, all these things that we've learned over the last year and a half. And if we layer all those together, I think we can safely do school in person. And not only can we safely do it in person, but we won't be having constant interruptions with quarantines and isolations and classes canceled. So for now, I think the safest way to do it is to follow what the CDC says, follow what the American Academy of Pediatrics says, and use that layered approach where everybody indoors at school is masked and we're distancing as much as possible.
Our next several questions come from Sari Lesk with the Milwaukee Business Journal. They are for Commissioner Johnson. The first one is, other than promoting the vaccine, what specific steps is your department taking to combat the spread of COVID-19?
So we're continually, obviously, promoting vaccine. I just want to highlight again, the way out of this pandemic is through vaccination. And every person who's not vaccinated is a potential host for another variant. It is so important that the emphasis and focus is on vaccines. That's where we're most heavily focused. But we're also working with all of our businesses, schools, and other organizations to ensure that they can continue to operate safely. We are meeting with businesses, and like I said earlier today, I met with a lot of people from the entertainment industry and hospitality industry about how do they keep their patrons safe? How do we feel comfortable moving forward? To Dr. Weston's point, we're in a different place. 50% of our population is vaccinated. We know they can still become infected, but they're protected against severe illness and death. And I think that is, again, a message we just need to continue to make, that certainly we're not out of this. We have a lot of work left in front of us, but our way out of this is vaccine.
And through those conversations with businesses, what are they asking your department right now in regard to how the city approaches the pandemic?
We've been asked for everything from please reinstate health orders and a mask mandate and capacity limits to please let us make the decisions for our businesses, and everything and anything in between. I recognize we're in a really tough spot. The health orders have become really political. That's why we issued a mask advisory last week. I feel people should be masked indoors, and people need to get vaccinated.
And Suri is also wondering what benchmark would have to be met for a new order from your health department.
I'm not sure if it's a benchmark. Again, we're in a different place than we were last year. Half of our city is vaccinated. The challenge is people who have underlying health conditions are still at risk, whether or not they're vaccinated, and children are not vaccinated at all. So, we're learning as we move forward, and I can't say for certain what the benchmark would have to be.
Our next question is for Dr. Weston from Caroline Reinwald with WISN 12. She says, how many employees are vaccinated in our regional hospitals? How many regional hospitals are or plan to require vaccinations for their employees? And what are your thoughts on medical professionals working in regional hospitals who do not wish to get vaccinated?
So when we look at numbers, and we use national numbers to understand the vaccination rates in hospitals, when we look at physicians specifically, the numbers are near 100%. Near 100% of physicians who are actively working have chosen to get vaccinated. I think that sends a strong message about the trust and confidence in the vaccine. The numbers do get a little bit lower when you look at other non-physician hospital providers and hospital staff. As far as which organizations in our community in Milwaukee County, the Medical College of Wisconsin, Ascension, Children's Wisconsin, Froedtert Health, the VA, have all announced vaccine requirements that they'll have in their institutions. As to the last question about people unvaccinated in healthcare facilities, the goal in healthcare facilities is obviously to promote health, and it's to promote health of their providers, but also of their patients. And we see with the Delta variant how easy it is to spread, whether certainly if you're unvaccinated, but even if you're unlucky enough to have a breakthrough infection when you are vaccinated. And so I think it's critical to have everybody in a healthcare facility, certainly everybody working in a healthcare facility, be vaccinated to protect themselves, but also to protect their patients.
Our next few questions are for Commissioner Johnson. The first one is from Kristen Barbarezzi with CBS 58. She says, are there plans to go back to capacity limits for bars, businesses, and restaurants?
I don't ever want to say never. Again, if anything we've learned is pandemic, it's not predictable. But at this time, no, we don't have plans to implement capacity limits.
And Carolyn Reinwald, but WISN 12 is wondering, you mentioned requiring city employees possibly being required to be vaccinated. When do you think that may happen?
I don't know. I know we're working very closely with DER and the city attorney's office and the mayor's office. So I can't answer that.
Follow-up question. The state said there were at least 491 confirmed cases out of the Deer District gatherings, but the number you gave was lower. Can you explain why? And is your number Milwaukee specific or is it statewide?
So the number I gave, I believe, was 457. That was the number I was given earlier today, and that is statewide. We were waiting on a data point from the state and hadn't gotten it, so I would go with the 491.
All right. Thank you for the clarification. And the final question I'm seeing right now is from Sari Lesk with the Milwaukee Business Journal for Commissioner Johnson. Sari says, if the way out is vaccination, what plans has your department put together to reach and convince the people who are either hesitant or altogether refusing the shot, other than asking people who are vaccinated to talk to people they know?
So, I think there's a couple of different approaches. Our most effective approach to date has been going door to door and answering people's questions and making the vaccine as available as possible. We're continuing that door to door effort throughout the city in the zip codes and neighborhoods that are least vaccinated. Again, getting the vaccine out where people are, bringing it to people where they are has been effective as well. And then finally, I think the conversations around mandating a vaccine, potentially needing to be vaccinated or a negative test to come to work, potentially needing to be vaccinated or a negative test to attend a large event, I think is incentivizing for people.
Two more questions here from Allison Durr. I'll ask one at a time. So given the cases confirmed from the Deer District, do you think it was unwise to hold such large gatherings there?
So anytime people gather, I think it's important to recognize anytime there's a large gathering of people, we're going to see the virus spread. And that number is from the entire month of July. So it's not linked directly to one day, the final game. It's through the entire course of the month of July. And we're still collecting data, so the number is likely to grow. So again, any large gathering, I would anticipate we're going to see numbers. Part of that, though, too, is that people weren't just attending events in the Deer District or gathering in the Deer District or watch parties. They were also going to bars and parties at friends' houses and family events. And, people are gathering with others, and that is going to cause the spread. So if you look at the total number of cases connected to the Deer District over the past month compared to the total number of cases in the state, it's really not that significant.
And Allison's second question is, would you support holding a Common Council special session in August to implement COVID precautions, or would you be okay to wait until the Common Council returns in September?
So I really think that's a question for the Common Council members. I know there are conversations right now happening amongst them and with President Johnson about whether or not to convene in August.
All right. Those are all the questions I'm seeing in the chat. Deborah, thank you so much for joining us today and sharing important resources. Thank you, Commissioner Johnson and Dr. Weston, for being with us. And we will see you all next week.
Thank you.
Thank you.